Greetings, everyone. Welcome to Bright Spots in Healthcare. This is Eric Glazer, and this show, as always, is produced by Bright Spots Ventures. Our mission simply is to spotlight what is working in healthcare and how to help scale it. We bring leaders together across health plans, health providers, and innovation solution providers to come on this show and share their ideas, their strategies, things that are working that create real world impact. If you are new to us and you're attending your first episode, I highly encourage you to go to your favorite podcast app that you listen to podcasts on and type in Bright Spots in Healthcare and subscribe. That way, every Tuesday, you will get an episode downloaded to your device so that when you're on your walk, when you're on the plane, when you're in the car, whatever you listen to podcasts, you can get some incredibly good ideas that could help forward your career, help forward your organization, and most importantly, forward healthcare for all of us from all the great guests we're privileged to host each and every week, like the ones you see if you're watching now via Zoom before you today. Today's topic, Medicare Advantage. And today's Medicare Advantage landscape is defined by, the rising stars, the cut points, the rising star cut points specifically, the tighter experience expectations, and members, consumers who want simplicity instead of all of the noise. And that dynamic I'm experiencing firsthand as a caregiver of my father right now. And it reminds me of something I used today, something outside of healthcare that I use today, and that is Spotify, which I always put on for my morning walks. So when Spotify, when you think about it, when they entered the market, music was everywhere already. And the challenge wasn't accessing it. The challenge was friction. People were juggling downloads. We had storage limits, single track purchases, and this endless kind of consumer management of our tunes, right? So Spotify didn't reinvent music, but they reinvented the experience around it. Now we've got unlimited skips, seamless ability to create playlists. I could listen offline while I'm up on the plane. Personalization, get personalized suggestions and playlists. It's just a simpler, coordinated experience for all of us. And that subtle reframing changed the entire industry. It raised our expectations and ultimately created what is now, as of yesterday, a $115 billion market cap for the company. So healthcare, especially Medicare Advantage, is in this similar moment, right? Progress often comes not from new programs or new regulations, but from reducing friction, simplifying engagement, just making our entire consumer journey feel more coordinated end to end. So that idea, improving experience around a familiar service, is exactly what today's session is all about and why today's session is supported by our friends at Vori Health. They're one of my favorite companies to work with. They're taking a historically fragmented area, musculoskeletal care, and redesigning how people access it. They're physician-led. They're an MSK practice, but they blend virtual visits with in-person support so consumers can get evidence-based care quickly and easily. They're not a point solution. They're a coordinated whole person experience that's reducing unnecessary surgeries, hospitalizations. They improve symptom control and support just a stronger digital satisfaction. All critical as stars expectations rise. So you can check them out at vorihealth.com, VORI health.com. I'll also tell you a little bit more about them later on in today's episode. I want to get started. We're going to put the bios of today's guests in the podcast show notes and in the chat if you're watching via Zoom so that we could save some time, but you could get a little sense of the expertise and experience you're about to benefit from. Our guests today in order are Carrie Clements. She is the Staff Vice President of HEDIS Improvement at Elevance Health. Lisa Franklin, she's the Director of Medicare, the Medicare Business for Product, Marketing, Strategic Growth of all government programs at CareFirst. Christine McKinney, she's the Vice President of Customer Experience and Digital Transformation at Blue Shield of California. And last but certainly not least, Dr. Mary O'Connor, who is the Chief Medical Officer and co-founder of Vori Health and would be head of their crew team if they had one. All right, let's take the idea of reducing friction and creating a more coordinated experience, and look at how it's playing out inside of Medicare Advantage organizations. Let's go down to the nation's capital and start there. So, Lisa, how has CareFirst raised the bar in how members receive information and get connected to their care? And what drove those changes? And as you're talking about that, maybe some surprises that you saw as you kind of move towards this more coordinated digital first strategy.
Yep. Yeah. Thanks for having me today. Excited to be able to share this information. We looked at all the communication that we were doing across the board. So not just your regulatory, your marketing, but any outreach that our folks were doing. So whether it was our health services team, pharmacy team, vendors that we had approached to do communication on our behalf. And we took all of that information, pulled it all together to see what are the different ways they're reaching out to members, how often are they reaching out to members. The surprising part for us was we found that we were reaching out to our members 175 times a year, which meant
Oh,
they had a touch point from us almost every other day, a uncoordinated touch point. So we were either sending them material, we were maybe doing some sort of digital campaign, potentially a vendor was outreaching, and CareFirst was also outreaching internally, multiple calls. And that experience alone was causing a lot of friction. We were getting feedback from our members that why am I getting a letter from a vendor I've never heard of? Did you sell my information to someone? And then we were getting we were also seeing that folks that were our community health navigators or even our sales staff that were out in the market, they would see our materials in the members' trash can. And so that was also eye-opening for us, right? Because we're like, we spend all this time and money to create these different materials, but we realize our members aren't engaging with us in the way that we probably would have looked at maybe years ago, and we needed to change the way that we were doing things. As we've been in the market for a couple of years, and we were very mail forward, sending postcards and calling our members nonstop. We took that opportunity after we saw the results of our internal kind of survey process that we did and decided let's go in a different direction. Let's go digital first. While these are Medicare members, or some of them are Medicare, Medicaid, if they have a dual special needs plan, we found that they were very digitally savvy and they wanted to engage with us more from a digital perspective. They wanted chat, they wanted email ability to be able to reach us faster. So what we did was we launched some campaigns from a digital perspective through this scrolling content card perspective. So folks were very used to those Facebook Reels or TikTok, and we came up with a very similar concept there to give them information not just through a 60-character text message, but instead through various different channels where they could actually have a call to action, and we could see how often they click through and go all the way. We saw from our ad hoc campaigns about a 15% click through, which is fantastic. 20% is the benchmark, and we were getting there. So we revamped and kind of relaunched, thought through how do we start to engage the member from day one. So we looked at what, as they come into us during AEP, outreaching to them right away with our digital campaign, informing them about how we're going to do outreach, all of the services they have available to them, and then keep that up throughout the year. So we just started this AEP, but we're looking forward to looking at our results over this next year as we start to kind of shift the way that we communicate with our members.
I love it. So first of all, you were inward facing and honest with each other. They're like, holy cow, 175 touch points per member
It's a
per
lot.
year. That's not good enough. That's bad, right? So you admitted that. And then you came up with this digital first strategy that created initially at launch 15% click-through rate. Then you're taking an analysis of when they're clicking through and where they're engaging throughout their member journey. And you're currently making enhancements and making it just part of your foundational culture of how you work with your MA members.
Yeah.
That's
Yeah. Helping to
super,
inform them up front. Yep.
super interesting. Love it. We are okay. So let's great stuff. Let's jump to, Mary, Dr. O'Connor. I opened up the episode talking about one of my favorite apps, Spotify, and how that changed the music industry by removing friction and making the experience easier, but not by reinventing, right, the core product. I think digital health and Medicare Advantage is facing a similar shift. So strong clinical outcomes right now, they're not enough, and the experience still makes if the experience still makes the member work too hard, right? So what have you learned about co-designing with health plans a digital MSK journey that supports outcomes and also
Yeah.
feels simple, coordinated, and satisfying for seniors to move through?
Well, Eric, thank you. That's a great question. Delighted to be with everyone. I think one of the most impactful things that we've done with Medicare Advantage patients and our payer partners is the way that we've structured contracting to be a value-based care model. And that gives us the flexibility of providing services that would not normally be covered in the traditional fee-for-service world, like health coaching, like a registered dietitian, where, in the traditional fee-for-service Medicare world, you have to have really bad kidney disease and be diabetic and be obese before you can ever see a dietitian. So right from the start, it's recognizing that what members really want is to be seen as that whole person that they are, and then to deliver the support services to them in a way that's easy and convenient. And I want to echo Lisa's comment that, more and more seniors are digitally savvy. And in another 3 to 5 years, when you think about the progression of society, everybody, all Medicare Advantage patients and seniors are going to be comfortable getting on a video call. So it's really focusing on that experience of the member to say, we're going to make it easy for you. It's easy because you can easily access us through a video call. You can access us through asynchronous chat and messaging. We're going to make your home exercise program easy and more engaging because we're going to have sensorless motion tracking for your home physical therapy program. We're going to have health coaches to support you, registered dietitians. We're going to work with your PCP, right? We never want to give the impression that we're not part of that patient's whole care team, because we are. And furthermore, we want to support our payer partners with specific programs that they might have, for example, related to behavioral health. So with one of our partners, we normally screen all patients with a PHQ-9 for depression, but those patients that are flagged, we of course internally, we are always reaching out to them, but we will also be referring them to a specific support program that the insurer has. So there's ways of working together that are synergistic, not just for the patient, but also for our payer partners, in addition to working on STAR measures, which I suspect you'll get to.
Great stuff.
Yeah.
I'm going to go to the, by the way, folks, if you want to help me co-moderate and you're attending live, of course, if you're listening on the podcast, this is not going to be for you, but if you want to help me co-moderate, there's the Q&A module at the bottom of your Zoom interface, and you could throw in questions to us. That way, my team will be looking for them and be pinging me to integrate them as appropriately into the flow of today's conversation. And we did get a number of good questions from a bunch of you upon registration that we'll try to sprinkle in as well. I want to go to the West Coast now to Christine McKinney, who runs customer experience and digital transformation at Blue Shield of California. And Christine, can you talk to us a little bit about how the approach BSC is taking to understand and prioritize improvements? Like, how do you even know where to go, especially as it relates to caps and stars throughout the year?
Absolutely. I'll focus on caps today because that's the area that I'm most accountable for. Obviously, digital, as Lisa and Mary mentioned, supports all of Medicare stars. But when I look at the experience and where we can influence from a caps perspective, some of the things that we've done in the last couple of years is really become data obsessed, not just member obsessed, but we're also data obsessed. So we found that there were some gaps in some of our ability to drive insights of really understanding the member experience throughout the year. Obviously, we're always going to have our CMS regulatory survey during the cap season. And we had some intermittent kind of mock caps, like a shortened version of the survey just to keep a finger on the pulse. But we realized we weren't getting the insights that we could find actions. So we needed to redesign that program. So we actually have launched what we call a simulation cap survey. It's the exact CMS survey, but we also add in open-ended questions at the end. So we can understand, why did the member rate us that way? What are their true gaps in their experience, in their journey, whether they're on a healthy track or an unhealthy track? Where can we help fill in those? And you talked about in the opening, and Lisa and Mary talked about this as well, it's our job to take the friction out of that healthcare experience. And the journey today just has natural points of friction. It's not seamless. The whole ecosystem, if you look at it, there's a lot of different players, some within the four walls of Blue Shield and some outside of it. So how do we make it feel like one connected, integrated ecosystem? So that's what we've been able to do with this simulation survey strategy. We have it running all year now, so we can trend, we can track for seasonality, we can start to really understand the trends year over year. And the things that we found are, again, the things that you all have highlighted. They want to be guided. Members need more help, hand-holding to guide them through. They want to be digital first. They want their questions answered right when they're looking for those answers. And so we've done future-facing things that we're building today, but what we were able to do in the short term, we know it's not scalable and we know it's not our long-term solution, but to fill the gap that we saw immediately is we invested in a specialized set of call center reps within our call center that we're calling care navigators. And they are really the ones that are there to help support and guide our members through their journey, because we know today some of our members in the Medicare space are very digitally savvy, but some aren't, and they still want to talk to somebody within the call center. And so we've been doing a lot to invest in making sure our members are aware that Blue Shield has their back. Whether it's a question they have towards their provider group or towards their plan benefits, we'll help them. We're going to help guide them through that.
You mentioned digital first, and I know I said we weren't going to ask this, but now I'm going to. We were talking before we started. Oh, we weren't going to get this, but now I want to. So when you're approaching and thinking about how do you, such a big member population, BSC, and the challenge of scaling towards digital first and whole person care, what are some maybe what I would call bright spots or things that you guys have implemented that you're particularly proud of? And I'm leaning towards the pharmacy and scheduling program right now.
Absolutely. When we looked at the data, accessing care was definitely a big opportunity for Blue Shield to help guide and support our members. Again, we don't own how many providers are in the state of California or how many appointments they have available to our members, to not just our members, but to patients in general. So we know that that's an area that members really feel frustrated about the experience. And again, we can't necessarily control for that, but we can help guide them and make it easier, take some of that friction out. So we're one of the first payers to partner with ZocDoc. And so within our digital Find a Doctor tool, we've integrated right then and there where they can schedule the appointment online through our mobile app and our web experience. So that's a way to take a step out of the process for them, to simplify it so that it is just right there in that one experience. Because we find healthcare can be very siloed and very touch point driven. So you complete one task and then you have to start and complete another task. So more and more we're trying to make that seamless and integrated. So online appointment scheduling is a big step forward there. The other, I'm going to mention two more. One is we've launched a member health record. So we've partnered with different partners throughout the state. So, it's hard for seniors to have different MyChart logins. We know that they are becoming more digitally savvy, but we wanted to make that easier. So we've integrated data that we have into one integrated member health record through our digital channels. So it doesn't matter which provider group they're part of, which MyChart, they would need a separate login. It's right there, all their labs. So it's all integrated into one view for them to make it much easier for them to manage their care. In the future, we also flag within there where they might have a care gap. And then we'll load in, now you can schedule an appointment right there within that experience. So it's really, again, connecting that journey and leading them to the right outcome. And then last, we hear all the time from members, they're really struggling with the rising costs of care, pharmacy being, prescriptions being a real source of that. So we've invested in a digital tool called Price Check MyRx, and this is a way for us to proactively message to the member. A lot of times, right, when the members come to us and look, we're trying to be more proactive and push and guide proactively. So if we know that they have a prescription written for a particular retail pharmacy, we will push them a notification to say, if you fill it at a different pharmacy, you'll actually save some money. And then that way, then they have the power, they can look and say, okay, between whether it's a home delivery option or 3 other retail pharmacies, then they're in the driver's seat, and it's right there in their digital experience, in their mobile app, where they can select what's, but maybe convenience and having a pharmacy closer to them is worth the extra couple dollars. Or if they're really in a pinch, they can drive the extra time or extra distance and save some dollars. So it's really like, we can't necessarily control for all those costs, but we can help be their advocate.
Yeah, love that. It's super.
Eric, what happened to your audio?
Okay, could you hear me now?
Yes.
Yeah, thank you.
I listen.
I was thinking of a joke, Eric. I was going to try and help you out here. You know?
He did. He jinxed himself.
Full disclosure, I am dealing with a little bit of a family emergency, so I'm not in my studio. I'm in Florida, and I put up a makeshift mic and everything, and I think what I did is I touched it. Anyway, sorry about that, everyone, but we're back, and hopefully that will be the last little snafu we have. Incidentally, Christine, I'm going to come back to you in a little bit, but I want to do a deep dive into that Navigator program too, that Navigators program you kind of teased for us. Mary, I want to come back to you since you called me out for not speaking. So as we think about how many plans are investing in HEDIS and STARS improvement, but they're still struggling sort of to convert those quality strategies into like real measurable performance. Where have you seen a plan like bridge that gap by getting better at both identifying the right members and coordinating the follow through? And if you can't mention the plan by name, that's fine, but like just tell us like the story about that.
So there's huge opportunity for us, particularly in the MSK space for that where Vori is. And we're working with our partners now on a couple of key STAR measures. And a couple that I'll highlight is osteoporosis management for women. And a subject near and dear to my heart, my own mother had a hip fracture. Like hip fractures, I've operated on thousands of patients in my surgical career with hip fractures are bad. Fragility fractures, bad. And we all know we're not doing all that we can to prevent it. So osteoporosis management in women is, of course, the STAR measure to address that, which is that the woman that has the fragility fracture needs to have a bone density study and be prescribed medication to treat osteoporosis within 6 months after the fracture. So therein lies part of the challenge. This is time-based. So getting prompt data, working with our payer insurer partners so that we can identify these patients based on claims really early on, and then being us outreaching to them, to the patient who had the fracture, to say, hey, we're right here, we're convenient. Your PCP could also do this, but you can see us really quickly, and we can help bridge that gap. And unfortunately, we know, sometimes it's difficult for patients to get back into their PCP in a timely manner in order to have the test ordered and the medication prescribed. I worked on this extensively in my surgical career. There's lots of barriers, and I'll tell you right now, the surgeons aren't going to do it. Ortho surgeons are not going to do bone health as a general rule for patients. So there needs to be another solution. PCPs are overwhelmed and busy with everything else. So we come in as that solution to see that patient conveniently through video visits, order the bone density scan, get them started on medication. We also, of course, in conjunction with that, and in addition to that, have fall risk prevention. Again, like let's get further upstream and help prevent the fracture from actually happening. And when we're screening our patients for fall risk, which we screen all our patients regardless of the payer for fall risk, we're then, of course, tying our bone health program into that. Another STAR measure that's worth, I think, mentioning is bladder control. We have an excellent, pelvic floor program, which we tend to think of as a program for women. But I'll highlight there's a lot of men, particularly men who've had prostatectomies for prostate cancer. They have a lot of pelvic floor issues as well. So we really focus on helping our partners achieve those STAR measures for the benefit that the payer achieves, but more importantly, because that's really what delivering good evidence-based healthcare looks like.
You mentioned fall risk, and I thought that maybe it's a good segue to a customer audience question that we got prior to the show. And so I guess I'll start with you, Mary, but then I'll open it up to Lisa and Christine as well. But what strategies have been successful in moving the needle, if anything, on like health outcome survey and some of these triple weighted measures? I don't know if fall risk is one of those triple weighted measures, but it just opened the door for me to ask this question. Like, what are some of the things that are being used? Are you guys involved in that? Have you seen your health plan partners leverage that? And then I'll let Lisa and Christine jump in.
I'm sorry, Eric, you were asking me the question. Yes, our health plan partners are very focused on the STAR measures.
Right.
And so the key for us to help them is the early identification of the patient. And for that, we have to work together to get the claims data promptly or identify the patient through another means. If the patient was hospitalized because they had surgery for a hip fracture, or there's a request for vertebroplasty or kyphoplasty to treat a compression fracture of the spine, that's another group that's a very important group for us where we can have a positive intervention. So it's working with them to identify the member that is at high risk or is actually sustained the fracture so that we can reach out and engage them. And you need to do it promptly. Like, this is the moment when the patient and their family are recognizing that something needs to change.
Makes sense. And Lisa, is someone who's sort of in charge of holistically the entire government program.
Yeah.
Like, what are some of the strategies around HOS that you guys are leveraging to make sure that you're targeting those high impact areas?
Yeah, I think so part of it is trying to figure out how the member wants you to outreach to them. And I'll say one part of what we're doing is looking at, from an enterprise-wide perspective, like a content and preference management perspective. So if we have these triple weighted measures, right? We're trying to outreach to the member to have them do a specific service or get them to do, the activity that we need them to do. But if we're just calling them nonstop, but they actually prefer to have email from us, or they want us to outreach to them somewhere different, that's where we started to think through some different strategies, right? Like, how do we make sure we know how you want us to interact with you so then we can get in contact with you faster, so then we can get you to do the activities that we need to get done throughout the year. So that's been just something I think different that we've thought about, is let's not just continue to do what we're doing, but think about how do we change what we're doing. Because we've found that to move the needle on some of those triple weighted ones, like especially medication adherence, it wasn't working for us to just keep calling the member to say, go and fill your script. So we had to think of different ways. Do we work with the pharmacy? Do we work with the provider instead to really drive those measures forward instead of putting all the onus on the member?
Right. So, basically a definition of lunacy is doing the same thing, expecting different results or something. You guys seem to just be transforming the whole way you think about things. Anything to add here, Christina, or should we move on?
We're very similar to what Lisa was and what Dr. O'Connor has said. We definitely look at how can we integrate messages. There's so many similarities across stars in terms of themes. So definitely provider partnerships is very important so that we're aligning to the same goals, identifying those members, looking at our care management program. So whenever we are having touch points with the members to make sure we're integrating all the key messages that are important to that member. So we actually have almost like a wall calendar that we send to our members, and it integrates all the messages that we know are very important and prioritized from a STARS perspective, so that we are ultimately driving the right outcomes for our member. And again, showing it in a way like I love the way Lisa said that the burden isn't on the member, but it's really all about us linking arms and the member knowing that we're here to help them be successful.
Got it. I want to get into your care navigation program. Before I do, I want to just take a quick moment to again acknowledge our partner for today's episode, Vori Health. We can't do these episodes without great partners like Vori. You know, if you've been tracking the conversation, you've been taking notes. Incidentally, by the way, we'll send everyone a key insight summary, which is a combination of the AI transcript and my personal notes, and we'll send that out to everyone who is listening right now. So, but the pattern that I'm noticing is Medicare Advantage is going through the same shift as we all lived through with digital music and Spotify, like I said at the beginning, where the music didn't change and the experience did. And we stopped tolerating the friction. We wanted a clean way to get what we need without bouncing around between apps and devices or steps. And that's what's happening in Medicare Advantage, especially MSK Care and Medicare Advantage. Members don't want to figure out who to call, what comes next, and how to connect the dots. Neither does the caregiver, as I am living through this right now and trying to do all of that live as we're recording the show. We just want a simple connected path. And that is exactly the problem that Vori Health is built to solve. They're physician-led MSK medical practice that blends this fast virtual access with in-person support that seniors still rely on. So most members are seen within 48 hours. Most members are seen within 48 hours, under 48 hours, I should say. And it's not just a virtual PT doorway. It's a fully wrapped clinical model. Physicians, PTs, health coaches, behavioral support, all working, all rowing in the same direction so that the patient, your member, isn't doing the coordination themselves. So for all of you health plans listening, what does that mean? It means unnecessary procedures, better symptoms control, stronger digital experience scores, and alignment with the new 26 CMS measures focused on physical and mental health. Total cost of care goes down, your star ratings and caps will go up. It hits the exact pressure points that all of you are managing right now. If you want to learn how Vori is helping plans improve outcomes, reduce all of this, simply go to vorihealth.com. But I am going to bring this up. If you guys do want to just chew the fat and learn a little bit more about what some of the innovators are doing around the country, and you want to talk to Dr. O'Connor directly around digital whole person care integration, just the operational lift of making all of this work at scale. Over the next couple of weeks, Dr. O'Connor's opening up time for one-on-one just networking calls with health plan leaders. So if you want me and my team to help coordinate a meeting with her and you could simply take this quick poll and we'll set it up for you. Again, taking the lift out of and burden off of all of you, and we'll navigate that for you guys. All right. Let's get back to this Care Navigator so Christine, excuse me. You talked earlier about the investment in time and energy and money in this survey simulation that goes on throughout the year. The result was this Care Navigator desk. Could you talk a little bit about how it works and how it's delivering impact and value for you guys and your members, most importantly?
Absolutely. We definitely listen to our members. We gathered the data through the simulation survey, but then we also did more detailed focus groups so we can really understand from a member and outside in perspective where the members were feeling overwhelmed, where they were finding the biggest struggle points for them in their interactions with the plan. And what we found is that in California, for some of you who may not know, it's a delegated model. So there's a lot of accountability actually for care decisions within the provider groups and less from a plan perspective. But from a member perspective, what we found is they thought that the decisions and the holdups were with the plan. And so in the past, the answers that they were looking for specifically on was a referral processed, was a prior authorization approved. And so we found provider groups were pushing that information to their electronic health records, and the members weren't getting the messages that they needed. So we wanted to serve our members and make sure that they were getting care when and where they needed it, because that's what they are partnering and choosing Blue Shield of California to help them with their care. So we set up this desk. We've used a lot of omni-channel communications from a digital perspective. We have a very similar solution to what Lisa talked about in terms of the scrolling. We have also found really great success with that, but also engaging members with multiple messages. I know Lisa talked about engaging with your members too much. We also definitely look at that. And so we're very judicious, but we found that educating and driving awareness for our members that this Care Navigator desk exists is incredibly important to our members, to feeling confident that they are going to be able to successfully navigate the healthcare system. So for an example, like a use case that might come through the Care Navigator desk would be, again, what I talked about before. I've sat chair side and listened to some of these calls, and they're incredible. The members are wondering, they got the prior authorization approved, and then they made the appointment, and then it got canceled, and so there's like they're in this vicious circle. And so we'll come in, we will navigate that for them. We'll be on the phone. We'll either call the member back or they can be on the phone with us. We will figure out why their appointments aren't being scheduled. We'll get them appointments. We'll offer additional solutions for getting in to see care more quickly. So maybe they see a different doctor within the practice. We move to a virtual visit. So we kind of help them navigate how to get the soonest appointment. We have goals and metrics that we track that we want the desk to find that member an appointment within 7 to 14 days. Whereas before it was taking the members, 2 to 3 months to get in to see the provider. From there, then they'll mention that they don't have transportation to pick up their prescription, or that they want their prescription transferred. We will help them do that. We will confirm that the prescription's been received. One call I was on, the call center rep was helping her look up the bus schedule to get to the pharmacy. So it's really just end to end supporting the member. And then I can't tell you the amount of calls that we get back from the member so that they can record a message back to the manager, the supervisor over this desk, with tears, with the emotion of gratitude and relief that we were there for them to help them navigate this, because it would have taken them hours and hours, because they wouldn't have known who to call or how to do this. So as you talked about in the beginning of the show, Eric is talking about how to design scalable solutions. We know that this isn't scalable, but it is very important, and it is really serving the need. And so we've done some things where we're constantly looking at the data to see, okay, what provider groups, what members belonging to which provider groups are calling in the most? Where are we seeing those appointment challenges the most? Where are we seeing the drop off in communication the most? And then we have a team that's going back to those providers. So then we can kind of get it at the root cause, so that we can make that experience a good one for our members out of the gates, so that they actually don't ever need to be at the Care Navigator desk. But if they do end up at the Care Navigator desk, we've also talked to those provider groups so that the Care Navigators kind of have a backdoor line to those provider groups, so they get quicker service, and they're not going through the phone tree and being put on hold. So we're kind of always looking at the data to see, okay, now how can we enhance this, but truly always looking at what is the root cause and how do we solve this from a systems thinking perspective so that the members, it's just, we're taking that friction out from the get-go. And that's something that's very important, because to hear the confusion and the emotions from these seniors who have just had a diagnosis, or they'll just open up about how their spouse just passed away. I mean, there's a lot of complexity going on for those members at that time, and we have to do everything that we can to help them.
Yeah, it's so fun. It's like, it doesn't even sound like you work for a health plan the way you're describing all this. It's super interesting. No offense to health plans, but it just sounds like a different relationship that you formed, at least in that patient population that calls into the desk. What have been the results, though, more wide scale across the business?
We're seeing great results in our Net Promoter Score and in our CAPS survey performance with these members. As I talked about our simulation surveys, we ask a question, at the end, are you aware of the Care Navigator desk? And if they say yes, their CAP scores are significantly higher than those members who are not aware of the desk. And then we drill down to say, okay, those who are aware of it, how many actually used it? And it's a small fraction, but it's just the awareness that they know that Blue Shield cares enough about them and wants to help them makes such a difference. And so it is an investment that is very expensive, and it is something that isn't scalable to all lines of business. They're all members, but it's very impactful. We've seen our CAP scores for our HMO population rise over 1.25 points in the last couple of years. And with our PPO population in the last year, we've raised our CAP score by 1 point. And that was or 1 star. And that was enough to really tip the scales for our stars performance this last year. We hit 4 stars for our HMO, up from 3.5 stars, and our PPO, we hit 3.5 stars, which was actually a 1 star improvement year over year for our overall Medicare Stars program. So it's been incredibly successful.
Super cool. Folks, real quick PSA, in 2 minutes, you're going to get another email from me. I know, I won't apologize. We're going to be asking for your feedback about this episode. We'll also throw it into the chat right now. It allows us to pick topics for next year, which is a super important part of this survey, as we're already December 4th. We're busy planning into Q1 and Q2 programming. It also helps us get better. So if you could just take a few minutes to take that survey, it's literally designed to be completed in under 3 minutes. So we'd love you to do that even while you're listening to the end of the episode. You mentioned it wasn't scalable. I wonder if it will be in the next 18 months. And congratulations to everyone. We've gone 43 minutes without mentioning AI, but I'll break the streak. Lisa, I'm going to bring you in. I know you continue to make significant changes. Your organization does, and we're entering a year of changes in the market and a membership mix. And I've been in meetings where MA plans are freaking out because they've done too well in annual enrollment. So when you're thinking about AI, how do you see AI shaping the early experience now for your new members?
Yeah. Yeah, the Maryland market's always been a tricky market. We have a very low Medicare Advantage penetration rate, a very high Med Sup rate in the state. So in our market, just this AEP, we had 2 large national carriers exit majority of their plans in the market. And that left and then other carriers, they did some terminations. So over 100,000 members in our market had to shop this AEP. It could have been for plans with another carrier. We were one of the richest plans in the market at the moment, good or bad, right? We can take that either way. And so what we did find, and what we're seeing as we're wrapping up AEP right now, is that we will most likely have an influx of membership somewhere around 15,000 to 20,000 members. Now, that's a lot for us in Maryland because, again, we are very low from a Medicare Advantage penetration rate. So many of us only have about 15,000 members in our plan current state. what we found was that we want to be able to outreach to these members, right? They're switching from another plan. They're coming from fee for service. They're aging into Medicare, whichever it is across the board. But to outreach to that level of membership and including our existing membership, right? Welcome them back to the plan, make sure they have everything they need for the year, would take a lot of both dollars and manpower to be able to do those many calls. So what we did was we decided let's try AI this year. Let's incorporate what we need from a welcome call perspective. And ours is very focused on more of a stars and caps and risk adjustment side. So the outreach that we're doing starting in January to all of our members is to understand if they have a PCP, get them scheduled for their annual wellness visit, understand if they're taking any medications, get them over to our pharmacy team for any mail order prescriptions to get fulfilled at that moment too. And then also just thinking through what other questions they might have for us. How can we make sure that they are ready to just take on the new plan that they have? And so the idea is we're working with the vendor, right? Training up the AI. We have a script, but it's really going to be what's that conversation going to turn into. We'll start off by just doing a couple calls, and then a couple of us are going to listen to those calls to make sure that things aren't going south. There's not a lot of folks complaining because it could go either direction, right? We are going to make sure that the member knows that they're talking to an AI agent, but we want to be able to kind of understand and feel their sentiment from the call too, to make sure that we continue to do the calls over the month of January. So that's really one of the key components to how we're using AI from a welcome perspective. We've also incorporated it into medication adherence. And so we work with the vendor on that side to incorporate AI into making sure that our members are fulfilling the scripts that they're getting. And we unfortunately had a very low stars rating on our dual special needs side. And I think it's a tricky population to be able to make sure that they are adhering to the medication and understand why they need to. So we've had some great results just early in that process with using that vendor there. But we're going to continue to evaluate if the AI concept is working, and really making sure we're understanding from our members, are they okay with it? Are they not okay with it? How do we change? How do we adjust? So that's been just a huge part of what we're doing to incorporate it into our just overall strategy this year.
Good stuff. Lisa, you reminded me, we have a few exciting programs coming up before the end of the year. I'll let everyone know about them real quick. Two of them are for health plan folks only. Apologize to anyone else listening from hospitals or solution providers. Both, Lisa, were the ones that you prompted me to recall. We have one on December 12th, so in about 8 days at 11 o'clock. It's a little unusual time for us, 11 to 12 East Coast time, on Beyond Adherence, personalizing the medication experience to drive stars, retention, and total cost performance. It's a peer-to-peer roundtable. We limit it to a finite amount of folks. I facilitate it. It's a two-way conversation. It's not like a show. It's a private discussion. We call them private roundtables. That's December 12th. If you want to come to that, we also have one on December 17th around the AI roadmap for engagement and how to go from a pilot to a scaled impact. And that's on December 17th at our regular time, 12 to 1 o'clock East Coast. We're going to be talking about member engagement, consumer experience, strategy, innovation. Again, private event for health plan leaders only. I'll be facilitating private event. We'll take notes. We won't record it. We'll record it just to get the AI summary, but we won't be recording it for public consumption. For everyone, next week, regular time, Thursday, December 11th, 12 o'clock, we'll be hosting the Medicaid's, oh, look at this, we're doing a visual, we're just so high tech. Medicaid's communication wake-up call and how redetermination and work requirements are forcing just an entire new engagement strategy. So if you work on the government side, both CAID and CARE, this would be a great event for you to attend. Again, that's open for everyone. It's a podcast recording and webinar, just like you're on, and that's at 12 o'clock. We'll register folks for that as well. We'll put up the poll, and you guys, we could register you, and you don't have to fill out that form again. All right, we have a little bit of time left. We have some important topics to hit. So I'm going to come back to you, Mary, and talk about inappropriate care. I know MSK specifically, which is your sweet spot, inappropriate care is one of the fastest ways for a plan to lose economic stability. What have you seen? Where have you seen plans use earlier risk signals to intervene before a member ends up on an avoidable pathway?
So I think that is kind of the holy grail for all of us, right? We want to be able to identify the member at rising risk of healthcare utilization to intervene earlier, because the more upstream we can get with that member and their MSK condition, the more likely we are that we're going to be able to help them improve without expensive and risky services. So I think that while everyone appreciates that, there's unfortunately inappropriate, non-evidence-based surgery that happens all the time, every day, particularly in the spine world, but it may happen in a lot of other areas too, Eric. We just have the most data on spine. So that's a little disclaimer there, right? But it's not just the cost of that inappropriate spine surgery, but that risk to the patient of postoperative complications, reoperation rates. These are not insignificant. When some studies show reoperation rates in the first year after lumbar low back surgery could be 7 to 8%. Like that's huge. So the more upstream we can get, the more opportunity we have to help that patient improve with great non-surgical, multidisciplinary, holistic care. That's really the mantra. Where we've also had done some really exciting, innovative work with payer partners is in getting patients to us for us to evaluate them before advanced imaging. So while if there's some stat order, that's different, right? But for the kind of routine advanced imaging for regular MSK diagnoses, when those patients come to us, then we have the opportunity to engage them with great non-surgical care first. And you know what? Because we're a medical practice, if the patient needs an MRI, you know what? Our docs order it. So we're not denying appropriate services or care, but there's always a bias based on who you see. And if the patient goes to see the surgeon, there's a surgical bias in terms of the treatment that would be recommended and the evaluation of that patient, right? Surgeons are used to ordering a lot of advanced imaging, whether you need it or not. Ortho surgeons hardly ever see a patient without a plain x-ray. Now, I know plain x-rays are not expensive, okay? But like an x-ray to an orthopod, again, of which I'm one, is like a stethoscope to a cardiologist, right? So we order x-rays, whether the patient really needs an x-ray or not. That can oftentimes then lead to that MRI that really wasn't needed. But the other, I'll switch gears for a minute because everyone probably is pretty familiar with the inappropriate surgery, inappropriate advanced imaging conversation. I think there's another huge opportunity, and that is really looking at that patient that does need surgery or has been told they need surgery to evaluate them from a pre-op optimization perspective. So we have a whole, virtual program where we will take that individual and first assess, have they had good non-surgical care? If yes, and they need surgery, great. Now let's look and see if we can if there are risk factors that are reversible. You would be surprised at what the literature shows for anemia, even borderline anemia in surgical patients, which can impact their functional recovery, impact clinical outcomes. Vitamin D deficiency. Are there some groups where pre-operative rehab is going to make a difference? Not for everyone, but for some it will. This is like there's some really low-hanging fruit. And part of the reason why I believe it's never been systematically done is Medicare has never paid primary care doctors for a pre-operative surgical clearance visit, which is incredulous to me. But I don't make government policy. So that's another area where when we've worked with other plans, particularly groups that have an in-person surgical center of excellence, we say, well, let us see that patient first virtually. You can save the money and the expense of the member actually going to the in-person surgeon center of excellence until we've done our thing first. If they need to see the surgeon, then absolutely send them to the surgical in-person center of excellence so they can get a second opinion. Is this the right surgery? So lots of opportunity for us to be more coordinated, more holistic, drive better outcomes and lower costs, because we know that preoperative optimization programs decrease the risk of readmission, decrease length of stay, increase the likelihood of same-day surgery, meaning same-day discharge, so outpatient surgery. All kinds of good things that are good for patients and also good for whoever's paying the bill.
Love it. I mean, I know I'm biased here, but that's the most level-headed, pragmatic, smart surgeon you'll ever talk to. So again, if you guys want to meet Mary and you didn't fill out that poll, let me know and I'll make a personal introduction. Also, I know a couple people DMing me here on Zoom about those private roundtables. If you're not a health plan, no, those aren't for you. But if you want to kind of figure out how to create a roundtable around a topic that you want to lean into together through a partnership, happy to talk to you about that. I just came out of one yesterday and someone said, you know what you guys are doing? You're building relationships at scale for us. And so I suppose I'm going to steal that line. And if you want to learn how to build relationships at scale through private roundtables, through a webinar, just let us know. I'll personally connect with you. You don't need to, we can just brainstorm on how to do it. With a few minutes left here, I want to look at the future here, Christine, and bring you back in to talk about, you've got a lot of things now going on with the Medicare Advantage landscape. You've got a lot going on with technology. How is BSC approaching the challenge of scaling towards digital first whole person care in 2026 and beyond?
Great question. It's as we talked about with scalability, really digital data technology is where we need to lean in, and that's where we're focusing. We're building, which a lot of companies out there today are doing, is building that member 360 view. So how do we create the unified patient member record so that we can have quick, real-time updates, personalization, next best action triggers for those members so that we can engage with them, to Lisa's point, at the right time in the right channel. So we are on the same transformative journey that Lisa mentioned. We want to engage fewer times with our members, but make it more impactful, more personalized. And how do we take the learnings from the care navigation desk and apply that and build that kind of navigation for our members from a digital perspective? So in concert with the member 360 that we're building, we're creating also ways that we can interact with members so that we can continue to learn. What are your preferences around providers?
Yeah.
What are you looking for when you're seeking care? And then not make that just a one point in time of knowing that about the member, but have that feed into what experiences we serve to them, either proactively or when they log into our mobile app or web, or if they call into the call center, or if they call into one or engage with one of our care managers. All that data is feeding all those interaction points so that the member truly understands that Blue Shield knows the member. And then we're looking at how we can leverage tools like AI in a really safe way so that we can mimic a lot of what the value the care navigator desks are providing, through guiding them and almost like answering questions that the members don't even know that they need to ask yet, but we know that that's going to be the logical one that they're going to have next. So let's package that all up together from a digital perspective, leveraging the tools and the new capabilities and technology and AI that are out there today.
Well, you gave me another analogy that I just thought of. This is going to date me. But in the mid 80s, every camera I owned, I think, was Motorola. And I remember reading about this in business school. Motorola realized that the variability in their products wasn't just coming from the manufacturing line itself, but the processes surrounding the manufacturing process. So the company built what is now known as Six Sigma. It's a little Six Sigma history for everyone, which is obviously a structured approach. We're probably all familiar with it in some extent about how to reduce variations and improving consistency.
Yeah.
And the results, right, were remarkable. So they ended up winning the Malcolm Baldrige National Quality Award within just a few years of implementing Six Sigma and how they just thought about this. So what made me think about it is it's mirroring everything that we've been talking about today. Medicare Advantage, like the biggest opportunities aren't always the new programs or the technologies, they're in the handoffs, right? The digital to in-person, the care management to the providers. It's the outreach to real engagement. When those transitions are clear and coordinated, and the members feel like they're getting what they asked for and they feel supported and the outcomes improve, then all of you listening at health plans, you're better positioned for the rising expectations in this new ratings era with the new administration, right? So anyway, great conversation. I want to thank our three guests, excuse me, today for all their hard work in preparing and participating in today's hour. For all of you listening and watching, whether you're on a podcast, watching live via Zoom, we do not take the hour that you schedule with us for granted. We hope you use the insights and the ideas shared during this episode and bring them back to your organization to help your career, help your company, and most importantly, help improve healthcare for all of us. A hat tip to Nicole Roberts, the producer for today's show, and everyone behind her who helped coordinate this episode. We produce this podcast for all of you. This is your Bright Spots in Healthcare podcast. Take care, everyone. Have a good one.
Thanks, Eric. Happy
Thank you.
holidays.
Happy holidays, everyone.